In the hours leading up to giving birth, a woman's thoughts are racing with questions. Will hers be a long delivery? Will it be easy or difficult? And will she be ready physically? For Mrs. Rolla Crockett, who's about to give birth to her first child, the steps she's taken in the months leading up to this moment have given her confidence that all is well.
Come back together. So step, lift, and come back together.
That's because she's one of millions of American women who've participated in an exercise regimen. They know that having a baby can be a real test of physical endurance that can be nurtured by some good old-fashioned preparation. Angelica Divina-Grazia from West Hills, California is in her 6th month of pregnancy with her second child. Because she saw the benefits of exercise with her first pregnancy, she already knows the positive results it can have on her pregnant body.
One of the worst things about pregnancy is just feeling like you've swallowed a basketball. And when you're actually active, you just feel better, you feel normal.
For women who have had a regular exercise regimen before getting pregnant, continuing to exercise with adjustments along the way will be easier. For those who have not exercised regularly, knowing when to begin is the first step. Dr. Lauren Hyman from West Hills Hospital explains.
I think that it is important to find out from your own physician what they recommend as far as how much and how often to exercise.
The recommended amount of exercise during pregnancy is 30 or more minutes of moderate exercise on most, if not all, days of the week, each time with a warm-up and a cool-down period.
In general, it usually is safe for a pregnant woman to exercise if she doesn't have any other medical problems that need to be taken into account. If they've been walking while they were trying to conceive or before they knew they were pregnant, they can continue to walk. If they're doing a cardiovascular program, they can continue to do that. I generally advise that women avoid any exercise regime that may be dangerous. For instance, if they're doing some sort of an exercise regime where they may be more prone to falling, to hurting themselves, to stretching muscles, then they may want to back off a little bit from that specific exercise.
During her first pregnancy with her son Chasen, Angelica enrolled in PregnaGym, a gym specifically designed for pre- and postnatal exercise. She was hoping exercise tailored for the pregnant body would prepare her and reduce her anxiety over labor.
I was really nervous about the whole 9 months and about delivering, never having experienced a delivery before.
With weight gain and other changes going on in her body, Angelica knows it's important to keep her exercise regimen going full force.
So I do aerobics quite a bit, and I do weight conditioning on my off days. Instead of lifting the normal amount, I lift about 70 to 80% of the weights I do, but as far as repetition, it's about the same.
Altering the different kinds of exercises may be needed as the body continues to adjust to pregnancy. There are some specific exercises that are best for the pregnant body.
Swimming is a wonderful exercise for pregnant women. Walking is also an outstanding exercise during pregnancy, and it's a way to get outside and to enjoy the fresh air. I think pregnancy yoga is absolutely fantastic, and I think low-impact aerobics are a great way for a pregnant woman to exercise and to keep strong during her pregnancy.
Becky De Leon, nurse manager of PregnaGym, advises gym members to make changes to their exercise routine to accommodate their growing stomachs.
Contract all those muscles down there and you will really develop those low back muscles. What we do is we monitor their intensity, their duration of that intensity, and the frequency of that exercise program. They lie on their left side, which is good for the baby, and then ankles to their bottom. Those hamstrings are lifting that weight.
But you can absolutely exercise in the comfort of your living room if that makes you happier. The important thing isn't where you exercise, it's that you exercise, and really you can exercise anywhere.
The baby's heartbeat.
Elisa Stutz is excited about being pregnant for the first time. After listening to Dr. Hyman's strong recommendation to exercise during pregnancy, she enrolled at PregnaGym. With an exercise program designed specifically for pregnant women, Elisa's goal is to keep her body in shape now so she can have an easier recovery after the baby's born.
I just want to stay in good shape, and I want to have a good delivery. And then after the baby's born, I want to lose my weight and get back into shape again.
All the strength that she's put into her body during the 9 months of exercise really pays off when her body's recovering. The women who have been exercising throughout their pregnancy simply recover a lot more quickly and a lot more easily.
I've always exercised and I've always belonged to a gym, so now that I'm pregnant, I'm just continuing with the program, just altering it a little bit to adjust to my pregnancy. Plus, your body tells you what you can and cannot do. My stomach's getting bigger and bigger, so I can't really bend over the same way, and you can't kick your legs up as high.
Exercising during pregnancy is ultimately preparing the body for the task of labor and delivery, which benefits the baby as well.
Pushing the baby out is like running a marathon. It is the absolute hardest, grueling exercise you will ever put yourself through, and it is absolutely exhausting. So having that extra strength, having that extra energy, and having the extra focus that often comes along with training and exercise is always helpful during the second stage of labor.
Exercise may not guarantee an easy delivery, but it may provide some relief during the birthing process. Lauren Enquist, Angelica's husband, believes exercise played a major role in the delivery of their first child, Chasen.
She really just cruised through it, and I think a big reason was she was in such good physical shape. Many people take it so easy during pregnancy that they're not up to the challenge when it comes time to deliver, but she was such a trooper.
For me, my delivery was probably the easiest part of the entire pregnancy. But the fact that I think I was in good shape, it was a lot faster and a lot less stressful and less drama than what you hear from other people's stories or things that you see on television. It was just very peaceful, which is what I'm hoping for this pregnancy.
9 months of exercise, and the body's finally ready for birth. The stamina, power, muscle, and determination a woman gains through exercise is rewarded with the added strength to deliver a healthy new baby.